If ever there was a conversation that I'm looking forward to, and I've said that with a few conversations, but this one is going to be fairly interesting. How about the application of breathing for recovery from addiction? And this is something that we see. It's not something that we've all experienced, thankfully. Many people have experienced it, and it really must be a dark hole when you're in that place. This is a conversation bringing together somebody who works in the field, but also somebody who has experienced just that. So I'm talking with Tyler Houston, if I pronounced the surname correctly, from Vancouver Island in Canada, and Paul McNerney from Scotland. And yeah, we're just going to let it flow. And we were kind of chatting just before we decided, we were chatting, and it's really, really interesting. But I have to say, Paul, I'm going to start with yourself. How did it feel when you were waking up in the morning and when you were during the height of your addiction? Could you just give me a kind of, were you just totally in the throes of,
I didn't really sleep, Pat. I didn't really sleep, to be honest, Patrick, you know what I mean? It was broken sleep, do you know what I mean? I used to get, and it was sleep apnea, I think. We're reading your book and that, and I read the oxygen advantage and that, and then obviously I started studying about echo breathing and that. It was sleep apnea I had, do you know what I mean? And I think it was used, but it was cocaine addiction that infused it, you know what I mean, to be honest. Because whenever you're taking cocaine, your nose is blocked, do you know what I mean? It is, and then you start hyperventilating, and I used to twitch during the night, do you know what I mean? I'd jump out my sleep all the time, and I'd take panic attacks during the night and all this carry on, do you know what I mean? It was bad, do you know what I mean?
So did you have a stuffy nose as a kid? Do you remember?
No.
No.
I really didn't, do you know what I mean? I was overweight, do you know what I mean? I've always struggled with my weight, do you know what I mean? And I think that's to do with addiction. I know I had a lot of trauma when I was a laddie.
And do you remember being tired in school?
Aye.
You were tired?
Oh, aye. Definitely, aye.
Did you have difficulty concentrating?
Aye.
Did your mind race as a kid?
Aye. My mind's always raced. I had trauma when I was a wee boy, do you know what I mean? I fell in a bucket when I was about 1.5. There was a bucket used to catch strips outside in my back garden. I used to get that off my neighbour's shed, and I fell head first in it. My brother pulled me out of the bucket, do you know what I mean? So I had that. I was about 1.5, and then I drowned I nearly drowned in a burn. My mother and her pal were over watching us, and we used to play at a wee park. Me and my brother walked away, and I fell in a burn, and I nearly drowned in the burn. I was about 2. Now, I had a lot of bits of trauma. Aye, a lot of trauma, do you know what I mean, when I was younger, you know what I mean?
Do you think that was what drove you towards the addiction? Was it the racing mind and the trauma?
I think it is. I think it's the racing mind, do you know what I mean? I can mind doing things repetitively when I was a wee boy, do you know what I mean? I was be into myself, do you know what I mean? Everything I'd done was overindulging things, you know what I mean? And it'd be the one thing all the time, do you know what I mean? Like,
no, but I get it.
Films and that,
you know I get it, Paul, because if any of us have a bad day, it's nice to have a beer that night, and sometimes you have one too many beers. I think it's kind of a normal response, isn't it? Unfortunately,
but I can mind doing that at a young age. When we started with food, do you know what I mean? And then I went on to smoking, and then went on to drugs, and it was cannabis, and then I went on to drink, and then just a project, but it was constant, you know what I mean? It's a gateway, you know what I mean? And it's just an illness, you know what I mean? Gateway to illness, and I started using ecstasy and then cocaine and alcohol. You know what I mean?
And were you using it every day?
I started using cocaine every day in the last 2 to 3 years. It was every second day. Whenever my body couldn't stop, I'd have a couple of days off it, do you know what I mean? But it was rife, do you know what I mean?
You'd go into withdrawal, so you'd have to go back on it then just to relieve the symptoms.
Anger.
When you start off with trauma like that, a few different sets of trauma at such a young age, you're going through it. I mean, the numbers are staggering when you start off at that age, that it's double the chance of ending up with alcohol or substance abuse if you're experiencing some sort of post-traumatic or trauma.
Definitely.
I mean,
I definitely think it's got a vital role in it. Do you know what I mean? I do. I go to Alcoholics Anonymous and Cocaine Anonymous. I've no shame in saying that. Do you know what I mean? And,
it's great that you are going. But Paul, is it the same? Do you think it's the same? Sorry, I'm cutting across you there. Do you think it's the same issues felt by everybody in addiction and recovery? You're talking to colleagues who have recovered now or in recovery. Did they all have the racing mind? Did they all have?
I think they do. I really do. I don't think it's just a drug and alcohol a problem at all, Patrick. I really don't. I think it's an everyday problem now. I think there's that many things that people can be addicted to in modern society. I think it's and obviously I think drugs and alcohol is the biggest part of it. Do you know what I mean? The hardest one. But people are addicted to everything. Do you know what I mean? There's sex addicts. There's computer addicts. But these things, that's terrible. Do you know what I mean? That's for especially youth. Do you know what I mean? I can see it in my own son. You know what I mean? And computers and that and all. Do you know what I mean?
Yeah.
It's something you need to avoid to focus on. Do you know what I mean? I think that's what it is. Do you know what I mean? I really do. I think that's what it is.
You got solace from the breath.
Oh, I definitely did. I was telling Tyler there. I started in. I'm about a year in recovery next week.
Wow, well done.
But I relapsed. You know, I had 4 months. Do you know what I mean? And I got 4 months clean and sober. And I was doing it my own way, but I got sober, and I was going to a couple of meetings. I was doing a couple of Zoom meetings a week, and I started exercising that again. I always used to get maybe 3 or 4 weeks off of drinking. I'd exercise and I'd feel better, and maybe I got a few months or. You know, I'd always get into exercise and feeling better about myself, but I suffered from a viral infection in, I think it was 2018. I think it was a coronavirus. I think it was. Do you know what I mean? Now looking at it, do you know what I mean? With all the information that's going on, and that, I get diagnosed with fibromyalgia, and I was using on top of that. Do you know what I mean? I think I was using that as a painkiller because my body was absolutely done, and I was in a lot of pain in that. And that escalated. They said there was nothing they could do for me, you know what I mean? So I was just unity of waiting and taking naproxen, and I stopped. I was self-medicating with coke and alcohol, and I came off it, and I got 4 months, and I started exercising, and I felt better, but I was getting withdrawals and that for the first month, and I started getting a bit of energy about me again, and I started getting the pain again. I was sore constantly. I was getting pain in my legs, and it was pain, mental pain and all. Do you know what I mean? I didn't know what I was suffering from, and I relapsed again, and I put a cut of stone on, and I said I'm going to do it right, and I went and got a sponsor. You get a sponsor in when you're doing a recovery program in Alcoholics Anonymous, no? So I got a sponsor, and I stumbled across
you got a sponsor.
Aye.
Okay. Yeah.
Just somebody will take you through the book Alcoholics Anonymous, and that a 12-step program, no?
Yeah.
I got a sponsor, and I came across the Wim Hof method. I started meditating actually when I get my 4 months, just to try and take myself out of my mind. You know what I mean? And,
how did you find that?
I really enjoyed it. Do you know what I mean? I really did. I loved it. You know what I mean? And I stumbled across the Wim Hof breathing and going for cold showers and doing that, doing the 12-step program and going for cold. I could feel myself, my body actually rejuvenating. Do you know what I mean? I can't explain it any other way. Do you know what I mean? The cold showers, especially for having fibromyalgia, I was in pain, constant pain, man, constant pain I was in. When I'm saying that, I had pains in my knees, pains in my joints, pains in my hands, pains down my thighs, just agony all the time, you know. And I started doing the breathing. I started doing deep Wim Hof, Tumo breathing, it's called, Wim Hof breathing. And then I came across, I watched your interview in London, Rio. I was actually staying with my mother at the time, you know what I mean? And she stays 10 floors up in a high-rise flat. And I started exercising that again, but I was walking up the stair and I could feel my chest breathing. And then all of a sudden, I think I was just sitting looking through videos on Facebook, and I came across your interview with London Rio.
Yeah.
I listened to the podcast, and I started breathing through my nose when I was walking up and down the stair, and see the difference it had on me. Do you know what I mean? I could actually feel it. It was like here on my chest. It's weird saying it. Do you know what I mean? But I could feel something happening in my spine, and it opened up my spine. I think. Do you know what I mean? And I could feel it soothing me. Do you know what I mean? And I could feel that with the Wim Hof breathing and all. I don't know if it was because I wasn't getting enough oxygen whenever I was using. Do you know what I mean? I just rejuvenated me. That's the only way I can describe it. You know what I mean? It's helped me so much, man. Honestly. as it's really helped me so much.
That's great. Tyler, you're working with people very like Paul, people in the military, people from all different walks of life. Is it, how, in terms of the mind, in terms of breathing patterns, what have you noticed?
Well, if I could just kind of put it to you, Paul, a little bit, and first off, just say thank you so much for sharing that story with us and the work that you're putting into working your program. You're just doing an incredible job,
Cheers,
and that's
you.
amazing. And all the things that you were mentioning, as far as cell phones and computers and all the other addictions surrounding things. I mean, all of that they're all contributors to dysfunctional breathing patterns. I mean, they're all drug use itself, all alcohol use contribute towards that dysfunctional breathing. But as far as they say that the opposite of addiction is connection. Mm-hmm. And I'm wondering if you can just speak to that a little bit, or see if does that resonate with you?
Aye.
And is that difficult even, as far as getting your sponsor and Zoom meetings, does that make it more difficult with COVID and kind of that connection end of it?
No, it's actually been better for me. At the start, I could only get to 2 meetings, and because I said I wasn't going to do Zoom and that, and we Zoom, there's meetings Alcoholics Anonymous and Cocaine Anonymous on Zoom every day. Do you know what I mean? All the time, every hour of the day. So it actually helped me. It helped me a lot, man. I think it's helped a lot of people, man. To be honest, you know what I mean? And every walk of life. I know it sounds weird, but people have had to get into their cell, and it's another way of reaching out. You know what I mean? I think that I know, but it helped me, man. It helped me. You know what I mean? And I was connected. You need to connect to people. Do you know what I mean? Especially when you need to share with people whenever you're in addiction. Do you know what I mean? It's a necessity. If you've got something in your head and you need to, even not in an addiction. If you've got something in your head and you think you're holding on to it, I think you need to go and tell somebody about it. Do you know what I mean? Because it just festers and it causes resentments, and it causes anger, and it causes fear, and it's just no good for you. It's not spiritual. Do you know what I mean? That's what I'm trying to say. It's not. People think they need to hold on to it. I think it's, especially in the west of Scotland, the Patrick's for Ireland and all, but the same over there. I've got a lot of people in North Ireland and all, you know, and they're all the same. It's all drinking culture, and it's all you're not allowed to do this and you're not allowed to do that, and it kills you. It actually kills you. It kills people. Holding on to bad stuff, it kills you. Festers in your body, and it makes you no well. You know what I mean? It really does. I can see that now, you know what I mean? But for 31 years, I didn't see it, do you know what I mean? I held on to everything my whole life. It's not that day, you know what I mean? Definitely connecting to somebody and telling somebody.
Who would you feel more connected to when Tyler was talking about connection? Is your sponsor a recovering drug addict?
He's a recovering alcoholic, do you know what I mean? So
yeah, because I think it takes somebody like that to know the mind, what's going on.
I think it's a spiritual process and all, do you know what I mean? Do you know what I mean? I think once you get connected to your breath, I think you're connecting to your soul, do you know what I mean? I know it sounds...
No, it's not new agey at all. But the problem with breathing is it's had a bad rap. Tyler, are people open to breathing if you're talking to her? Do they think it's a load of crap?
Little from column A, a little from column B.
All right.
Depends how you approach it, absolutely. And I mean, there's still a lot of rooms when the first time you mention the word mindfulness or meditation.
Oh, I don't mention it.
That's right.
Don't even mention it.
So what I find really helpful is that if you're in, it doesn't matter what the crowd is, you got to kind of feel it out a little bit, and then kind of find who your spokesman in that crowd might be. Find who might help you deliver that word of the breath and kind of help them, sign on quicker so they're able to help you get that message across to the rest of the peers in that group from the inside. It's always easier to access from the inside than from the outside. That's
But how do you find that person?
Pardon me? Well,
so you're looking for the role model in the group to help you do your job.
That's it. That's it. And it's just the reactions to kind of the little bit how you start off with. And to begin with, to put your toes in the water, to feel the temperature, I always kind of start when I'm explaining it, as I put the breath out there as our number one energy supply. You know, I put it out there as the breath is our number one source of energy. Even I advocate more important than hydration, than food or water, because how we breathe every moment is going to dictate how we feel in that moment, how we feel in that day. So I put it out there as, you know, we're going to learn to take advantage of this energy supply. And I just see who nibbles at that point, and from there kind of start shifting into beginning with some even more of the physical side of things. I find that's key, and that's really important to start off with the physical exercises, and just by leading with that breath, and just even after a couple of minutes, allowing them to feel the difference and feel it in themselves, and feeling their pulse even begin to slow down after just a few, you know, little bits and pieces. And then at that point, when they have a feel for the benefits of what this could mean, it kind of opens up the door at that point.
What do you do? What exercises? So do you bring in the walking with the breath holds or something like that?
You know what, again, it depends if it's strictly, if it's like a first responders group or a paramilitary group. But I always, before I even begin to talk about the breath itself, I always begin with the relaxation too, like just the kind of the stress releasing relaxation, like more so the body releasing. So just different even somatic forms of therapy to really start that muscles to be able to relax, to release that tension before we could even kind of begin down the breathing process and start to open up and kind of have us ready and open to do the breathing.
And do you think it's the same with Paul? Do you think sleep is an issue and trauma is an issue? These are guys, military and first responders are prone to it. Both groups are going to be.
Is that, sorry, to me, Patrick, or Paul?
So that's to you, Tyler. Just so Paul was talking about that he was tired as a kid in school.
Oh yeah.
And straight away you're thinking, well, it's so many kids are tired in school. It's completely overlooked. Mouth breathing kids. I was in that category myself. We're not unique.
See my own son, do you know what I mean? I can see it in my
Your son as well.
Aye, my son. Then I'm trying to get him. He is trying to do it. Do you know what I mean? But she try to teach into a kid to keep doing it. Do you know what I mean? Especially he's at that age. He's at 11 and he's starting to play with his own pals.
He's like my 11-year-old. It's easier to teach
it doesn't matter to do anything his dad tells him. Do you know what I mean? That's it. If your dad says something, you're like, I don't know. I know about our dad. Do you know what I mean? But I can see. I'm barely catching him. I've got a wee boy. I know at one. So hopefully I'll be able to catch him with him. Do you know what I mean?
But even the 11-year-old, you have
my son's been terrible with asthma. If he was a wee boy, he had croup when he was a wee boy. I think he was about 3. I think he got bad croup and he ended up with terrible. Every year he took right bad asthma. Do you know what I mean? And he didn't get his flu jab last year, and it's the first year he's not really had a bad dose. Do you know what I mean? And
do the exercise with him.
I've been doing the walking breath holds with him, and it's helped him a lot. Do you know what I mean? And see, whenever he gets a hanging chest, he's been saying he's been closing his mouth and trying to breathe calmly through his nose. So and he can see the difference in me with my breathing. Do you know what I mean? I think. Yeah. I mean, my wife, she's the same. I know she's had bad asthma all her life, and she started doing it, and you can hear the difference in her chest. Do you know what I mean?
Yeah. You're the role model. You're the one showing it off.
That's what happens. Once you see somebody getting well, you take it off them. Do you know what I mean? There's no coincidence it happens. Do you know what I mean?
No, I think you will have a phenomenal role to play when you meet your peers that are trying to recover. Because I'm going to go back to Tyler. Tyler, it must be easier for somebody to recover from an addiction if their physiology is in a calmer state.
Absolutely. Yeah, there's absolutely no question. And I'm just going to back up, Patrick, and I'm just going to kind of explain kind of who I am and how I integrate the program in. I think it'll explain a lot of how it's helpful in the setting, in the recovery setting. So my background is I'm a first responder paramedic, and I'm a mental health and addictions nurse. And I'm an occupational aware clinician. So that just means that I'm certified, trained to work with first responders and military and veterans with trauma and with addiction. And then the other piece, I'm a high performance coach as well. So I'm just gonna back things up a little bit more even. I grew up on a farm in the middle of Manitoba, a small farm town, playing hockey, and small farming community, alcohol very prevalent in that community. So grew up with addiction in the family, in the household. So grew up playing hockey in Manitoba, and then ended up moving to Arizona in the United States to continue playing hockey. And it's a hell of a lot nicer walking into a rink with flip-flops and shorts on than it is full skidoo suit on. So I played there for a few years, and then I found my way out to Vancouver Island. And that's where I am right now, near the ocean. And this is where I started to get into the field of, into the medical field. So, and again, I've got 2 young boys, and both of whom start off with compromised immune systems. So both have had pneumonia and bronchitis way too many times when they were very young. And that's what really got me into the field of medicine. So I've always been fascinated with the respiratory side of things, everything pulmonary, and that's what got me into the medical side of things. And that's what got me to the paramedic, to working and really focusing on the respiration side of things. But then moving to the island here, I really found that it was actually my passion that tied everything together, and that is freediving. And through freediving and through the breath holds and through spearfishing, I found immediately what that bit of breath work started doing for me, and started noticing my eyes getting whiter, my skin getting brighter just after, this little bit. The conversations with my wife, how they started going differently, the patience with my kids, how it seemed to grow and grow. So I knew I was on to something, and I knew that, this was something that everything together. But it was one day I was sitting at the nursing office at, I work at a few of the different addiction treatment centers here on Vancouver Island. And they're a couple of the largest in North America, actually. But I was sitting there, and I had a soldier come and visit me one day. And he was in full panic attack, and he came out of structure to see me. But, he came for his anti-anxiety, antipsychotic medication, his as-needed medication. So as a nurse, I, administered the medication. But first I asked him if he'd give me 10 minutes, 15 minutes, to go through some breathing techniques together. And after that 10 minutes, we just did some very basic relaxation, extended exhale to start to slow down that pulse and start to kind of get aware of that breath. And since that day, he stood up and left the office, and he left the pills in the container behind. And after that day, that's when, he followed day after day doing the same thing, and then his peers followed doing the same thing. And it was not long after that I hopped on a plane and came to visit you, Patrick, and train with you in London to further and to really gain solid understanding of the oxygen advantage technique, to really put that into treatment and into the treatment process. So after I returned to Canada, I started performing the structured activities, like as a part of actually the residential treatment structure, as the breath control training into the structure. And I mean, since then that's been about 3 years now. Wow, it seems like a long time.
Years, yeah, it does, yeah.
Together in person. But so since then, hundreds, if not thousands, of addicts and people struggling with trauma have gone through the program and found it incredibly helpful. And, the amount of pills that have been left in that container and, gone down the route of being able to connect, again, where it all starts with connection, I feel, Paul, connect with themselves first through the breath, and then, starts the process of, once you can connect with yourself, that's what starts the process of really calming that physiology and getting you to the place where you can begin to receive treatment and absorb treatment. So you connect with yourself first, and that's what leads to connecting with your peers, your sponsors, counselors, family, friends, and it just really does grow from there. But I feel breath work is, such an incredible key and a tool to use for the beginning of that process to start people into treatment immediately. Go ahead.
And Tyler, I'm just wondering, so if my head was absolutely racing, and if somebody's head was racing, I can understand why we don't want to connect with anybody else, and we're going to draw inwards, and we're going to be living in our head.
Mm-hmm.
But if we were to do mindfulness, we'd find it very challenging. And it's great, Paul, that you got really something out of it. That's super. Mm-hmm. So, of course, this isn't going to be that everybody...
It's always sometimes, I know, Patrick, but I've had days when I can't meditate. Do you know what I mean? My head's going that fast. I need to... And I found that breathwork's probably the best thing I've done for it. Do you know what I mean?
I think this is the key.
You know what
I think we need to start with calming the central nervous system, not having to pay attention to our thinking, and not even just paying attention to the breath, but using small breath holds, or even just breathe in, breathe out, hold your nose, and walk 10 or 15 paces holding your breath.
But Tyler was saying, I was on anti-anxiety tablets, and I was on antidepressants when I was 15-year-old. Do you know what I mean? Because I didn't really know what was up with me. Do you know what I mean? I smoked a lot of cannabis. You know what I mean? But I didn't know.
You weren't sure, was it the cannabis that messed the head or not?
I didn't know. Do you know what I mean? But I was on antidepressants on and off for 16 years. Do you know what I mean? And I've not used one yet. I've not touched any for I started doing this stuff. Do you know what I mean? I've not had to take any tablets at all. Do you know what I mean?
That's amazing. That's great.
Well, it's crazy how, do you know what I mean? I think that there's a lot of the pharmaceutical companies and that. You know what I mean? I think it's a lot.
I won't even go there because I'm going to start.
I know. I'm not. But do you know what I mean? I think it's there's ways to help yourself out taking tablets. Do you know what I mean? There really is. Do you know what I mean? There's definitely ways to help yourself.
Yeah. You're absolutely right. And I mean, I think that goes for most of us, that we all have times where mindfulness and meditation, we're not able to get there first, at times of panic and at times. So which is why just leading with that breath and 3 B's, right? Lead with the breath, the body will follow, the brain follows right behind that. You know, that's the sequence. And Patrick, when you're asking about when people first fresh into recovery, like fresh, even during the detox process, when just there's agony and there's sweats and there's pain. I mean, there's no way anyone's going near mindfulness at that point. And so absolutely to first get, just to first be able to pick up on something is, I even start sooner than that. And I begin with just the very first kind of de-escalation technique is just the hands on the side of the ribs and just to slow that breath down as much as possible. So the 3 second in, slight pause, 3 second out, just to get a feel, and even put thought into that transition of a pause, like more like a rolling wave rather than hitting a ceiling at that top, just to round off the edges of those spikes, that mountain range breathing, right? So leading in with that, the 3 seconds, slowing it down. And then from that point, it's a natural process, even because at that point, people still, and sometimes it's weeks and weeks into treatment before people still, that's too much. That's too much of a kind of a restriction, a barrier, or a trigger to cover your face or pinch your nose.
So the air hunger can bring on. So Tyler, when you're asking somebody, you're asking them to breathe in for 3 seconds and breathe out for 3 seconds. So you're reducing their respiratory rate down to about 10 breaths per minute. And we can imagine that they're probably breathing anything upwards of about 20 breaths, 15 to 20 breaths per minute. In other words,
depending, right?
Or even beyond that. This is where some people will make the mistake. And what they will do is they'll tell the person to slow down the respiratory rate down to 10 breaths per minute, but they don't take into consideration the tidal volume or the size of the breath. And it's always about that balance, isn't it?
That's right. Yeah, it's just keeping that homeostasis, right?
That light. So you're breathing in for 3 seconds. You're breathing in and out through the nose. So breathing in for 3 seconds. I'm assuming it's silent. Breathing in silently for 3 seconds. Breathing out silently for 3 seconds. So it's not disrupting the biochemistry, but at the same time, slowing down the respiratory rate is going to help stimulate the vagus nerve to bring the body into a little bit of rest and digest, to activate the body's relaxation.
That's right. And just by doing these small things at the beginning, and sometimes that's as far as they could go before, and if that's as far as we make it, that's enough to start the process going. And this, again, is so helpful at every process, because if we engage that, if we get patients or clients invested in the breathing right off the start, it's going to expedite that detox time. And that has such huge outlook on the rest of what treatment looks like, because if someone comes in or is just beginning stages, that first 48 to 72 hours, if it's, alcohol or opiates or what, or, even with cocaine, that's the most dangerous time of people leaving right away, right? That's when the withdrawals are happening. So if we can begin to start breathing at that point, it really does expedite the process of detoxifying and clearing out the system and flushing your organs, and everything begins at that point. Never mind just getting that little piece of calmness that the breath brings by increasing that circulation to the cells, to the brain. So if we can get that right at the beginning, then that does some incredible things at being able to actually absorb treatment. So sooner that we can, and have clients engage in treatment, the better off that chance of recovery gets. Every minute we can get them into treatment sooner, that chance of recovery goes up and up. So it starts off with that little taste, and that's where that connection comes from, through the breath, that you can feel that connection with yourself. And like I mentioned, then it carries on to maybe their roommates, and that, a connection is the opposite of addiction. So a lot of addicts are so used to isolating, and that's what the disease does. If you isolate, you stay away, you block everybody off. But it helps, again, as you're noticing, Paul, is being that role model. People around you start doing the breathing and start connecting more. And that follows through the whole treatment process. That follows the connecting again with your counselors, with your psychologists, with your doctors. And it's something that you can use through the whole treatment process. And even after that, it's something that you put in your back pocket as a relapse prevention failsafe, right? A technique in your back pocket, because it's you've got the tools, you know how to do it, you have it with you 24/7, it's always available. So as that relapse prevention technique, even out of recovery, out of treatment, and on with the rest of your life in early recovery. So it's just every single stage along the way, it's such a helpful tool and really main energy source, like I say, to take advantage of, to help heal and rehabilitate the entire body, mind, spirit along the way.
Do you find, Tyler, that, I think you kind of touched on it, that sometimes people starting off, that the feeling of air hunger or suffocation, how do you respond to that? I can imagine people with panic attacks, and you must have felt the same way, Paul, that that feeling of suffocation, and I know it's part of what we do, we're putting the person into a feeling of suffocation, and it can be very therapeutic, because you're getting the person, you're getting the body and the mind to surrender to the discomfort and to desensitize the body's reaction to the feeling of suffocation. What's a typical journey, Tyler, for when you're working with the specific exercises? And then
it's just that it's becoming comfortable in that slightly uncomfortable situation. And the key is baby steps, just slow and steady. I mean, the numbers of the rate of people in early addiction or early recovery who also have that high anxiety and panic disorder is staggering, how high that anxiety and panic is at the beginning stages. So a lot of times when I'm running groups, I have it set up as about a 6-week process like that to walk through. And we're talking control pause or bolt score numbers. It might be, a few weeks before I see anything over 10.
Wow.
In groups of 12 to 15 people. So that says a lot in its own, right?
Yeah.
That, just that high.
I think mine was about 9.
Yours was 9.
It was at the start, no. And I think that was about a month doing Wim Hof breathing and walking. So I don't know what it would have been like at the very start. I reckon it would have been about 6. You know what I mean?
Yeah.
So it's those baby steps.
Like a lot, do you know what I mean?
Yeah, and the teaspoons. Little teaspoons of air hunger, right? Little teaspoons of desire to breathe. Whereas keeping it as comfortable as possible at any time. That there's that anxiety or panic, if it does begin to creep in, then we stop right there, or you get the hang of it, you get the feel of it, and then maybe next week or down the road, the next day, maybe.
It's 26 now, do you know what I mean? That's mine, is up at 26, do you know what I mean? So it's rocketed, man, and it's
amazing.
It's only space here about 3 months, do you know what I mean, doing it. It's actually, it's crazy. The difference in my actual, the way I feel when I'm exercising, that's skyrocketed, you know what I mean? I've been climbing, I've been doing a lot, I've done a Monroe and the weekend there, and see the difference in my breathing, actually going up the hills, and it's just night and day. It definitely works. There's definitely something in it, you know what I mean?
I've just described, Paul, the Bolt score, or the control pause, just in case people don't know what it is. But basically, it's a measurement that we use to assess for functional breathing patterns. And the person is sitting down for about 3 to 5 minutes, just allow the breath to settle. And you need a timer. And just take a normal breath in and out through your nose, pinch your nose and hold your nose, and time it in seconds until you feel the first definite desire to breathe. And then let go. Your breath at the end should be fairly normal. So, Paul, yours was 9 seconds at the start, or even lower. And that would indicate that you had a fast respiratory rate, an upper chest breathing pattern, probably irregular breathing can be quite common, feeling air hunger. And then you tell us that you had to walk 9 stories or 10 stories.
Yeah.
Not ideal when a Bolt score is.
I started doing it. I could feel the restlessness, the rattle in my chest. You know what I mean?
Yeah.
And it was just night and day after about a month. Do you know what I mean? Doing it through my nose. You know what I mean?
Because a 9 seconds Bolt score, you're going to be overly breathless during physical exercise. You're going to gas out too soon. Have you noticed that your breathing now is lighter with the Bolt score 26?
Definitely, man. It's just my whole physiology. I've dropped about 4 stone and all. Do you know what I mean? And it's all connected. Do you know what I mean? It's not just I can actually I feel better breathing. Do you know what I mean? And so I can exercise harder. I've not even been exercising as hard as I used to. Do you know what I mean? I used to try and push myself, but I've been walking a lot longer now without getting knackered. My legs don't get sore anymore, and I've been doing yoga. I can stretch longer. I can stretch deeper. And you know what I mean? I always done a wee bit side. I used to go to gyms and that, and do boxing training and all the rest of it. And I'd always feel knackered. Do you know what I mean? I'd always feel knackered. Do you know what I mean? All the time. Even whenever I felt healthy, I still felt knackered. It's just not there anymore. Do you know what I mean? I can catch it with my breathing. Do you know what I mean?
How is your sleep?
Brilliant, man. To be honest.
Has it improved?
Aye. I got a tape, and I done that, but it won't stay on because of my beard. You know what I mean? It just won't stay. But I don't need it. I'm actually, I can feel. I'm waking up with a wet mouth. Do you know what I mean? And I never did. I used to have a cup of water outside my bed every night, and I'd have to drink that.
So you're breathing through your nose during sleep.
Aye. It's totally changed. I used to wake up a lot during the night. Do you know what I mean? Nightmares, and I don't get it. I don't get it at all, to be honest, anymore.
And nightmares can be a symptom of sleep disorders.
Aye, definitely. Aye, 3 o'clock. It used to be around about 3 to 4, 5 o'clock in the morning. I used to wake up. You know what I mean? And I don't get it anymore.
Patrick, you'd asked earlier about sleep, about how prevalent that is at the beginning stages with military or veterans or first responders. And I mean, I'm sure you run into this every day, but absolutely huge impact with, and it's a combination of, I think, the trauma experienced and just the shift work in and of itself, right? That a lot of these different physicians, nurses, healthcare professionals, firefighters, correction officers, that the shift work in itself lends towards that.
It disrupts the whole rhythm, so it does.
Oh, absolutely. That circadian rhythm is completely out of whack. And then when you add that hypervigilance that comes along with PTS or occupational stress injuries, a lot of the time, sleep is one of the biggest problems that people run into, and why, like, especially through addiction as well, when you throw that and drug use into it. But it's sleep, as Paul can attest to there, that is probably the number one biggest piece of feedback I get about the program that I run, is how incredible and how the improvements that they've felt in their sleep since they've started. And it might even be going back to before we even start about getting into like the mindfulness side of it. It might be just a little bit of the the slight breath holds, or even getting into maybe some of the altitude training, depending on the different stages. But before even getting to and really talking about the psychological side of things, we might have a firefighter sleep through the night without having nightmares, without getting up 2 or 3 times with nightmares. Or we might have, a veteran be able to sit through the dining hall with all the other patients without having to get up because it's too noisy and too distracting and too, the hypervigilant end of it, just overloaded. So these things start happening, and they're noticing these things, these changes are happening through the breathing. And then at that point, then the mindfulness side of things can they're already,
totally agree.
Benefits, and then,
hypervigilance. So we could interpret hypervigilance that the person is very much in a sympathetic drive. They're in that kind of constant fight or flight, always on edge, monitoring and always kind of scanning everything around them, that they can't just relax. So what you're doing is you're helping to bring them into a balance in terms of the autonomic nervous system, the automatic functioning of the body. How long would it typically take for somebody to start making progress with this?
Battery, it can happen as early as a couple of days. I'm saying as soon as they start switching over to that nasal breathing, it really can, especially as soon as if they start to tape up at night, and just really get that 24/7 nasal functional breathing working for them. It's incredible how quickly the benefits really do start kicking in, and they can start noticing it. And it's great to be doing it with other people at the same time to hold each other accountable, right? So if I run groups of 12 to 15 people, they can call, hey, Billy, close that mouth and breathe through your nose. They use that accountability, and it's a brilliant thing, and it really helps encourage kind of the absorption throughout.
Just that kind of support there.
Big time, and I put that out there right off the bat. This is a program that every little bit, every ounce you put into it, or every bit you put into it, you will get 2 out of it. So to get that initial investment in it, that, talking about the benefits and describing, what contributes to dysfunctional breathing, which we discussed earlier through, psychological injury, physical injury, laptops, computers, poor posture, on and on and on and on, but describing what that is and what causes that, and then getting rid of that and seeing what happens when you're able to be aware of what caused it, and then without it.
Tyler, and you know what, this isn't for just people, say for example with trauma and who have been recovering addicts, but like if we look at the literature, 75 to 80% of people with anxiety and panic disorder have dysfunctional breathing, and the most common form of dysfunctional breathing is hyperventilation syndrome. And this has been documented since the American Civil War, with soldiers returning back from the front line. It was first called the Costa syndrome.
Dr. DaCosta.
But how has it not, like, say for example, the 12-step program, you've brought it into addiction centers, but it's just been completely overlooked. And I would agree with you. I will say that if we want to get calmness to the mind, we have to look at deep sleep first. And then we have to look at functional breathing, and then we can bring in breath aware and body aware and mind aware. We bring in that once we get the foundations right. It's absolutely pointless, I feel, and I've made plenty of mistakes with this. I put people into panic attacks. Many.
I don't know. I was actually whenever I was doing the potato, I could feel myself. I went into a right bad panic. Do you know what I mean? I could feel it doing the small, because I didn't know. I didn't really understand it. I seen it. I was like, I want to do that. Do you know what I mean? So I signed up for it. I was sitting here and I could feel myself, but I'm getting right into a panic. Do you know what I mean?
The small breath holds.
It was a small. There was a walking one. I felt it at first. You know.
And, and Paul, just see, we don't always. I suppose my point here is that
it's a learning curve, isn't it?
We don't always know how the person is going to react to the feeling of air hunger. And we know with panic disorder that there's definitely 2 groups. And one group is able to cope with air hunger fairly okay, but the other group go into that suffocation mode to the point that they feel that they're going to die.
think it's maybe because of the trauma I've got, because it's water related, do you know what I mean? I think it's like feeling I choke myself, do you know what I mean? I think that's a lot to do with it, I know, do you know what I mean? Because I still get that whenever I'm in deep water, do you know what I mean? I still feel that. That thing, because obviously we're doing cold water, I've been in deep water and I've still got that panic, do you know what I mean? It's supposed to be about relaxation, you're trying to scatter out the water, do you know what I mean? But I definitely has something to do with it, do you know what I mean, with trauma.
Trauma stays, Tyler, because I've seen many accounts of people with a story like Paul's. They were in a swimming pool and some other brat of a kid got their head and dumped them under the water. And we can be talking to them now as an adult in their 30 or 40s. And when we put them into a degree of air hunger, it brings them back to the trauma that they experienced when as a child in the swimming pool. It's a long time staying there, huh?
Absolutely. And if it's not addressed, and if we store trauma in muscle groups and we store it in our bodies, if that isn't addressed and open up and unlocked, it'll be there your whole life. If you don't open it, it's just stored and locked in. So absolutely, it's there. And just speaking with water specifically, I mean, that's quite a common background. A lot of people have that association with water, and holding the breath kind of takes people back there. And what I love to do, if I have the opportunity, is at the end of the 6-week program, after a lot of baby steps, I love to be able to take people out to a pool and take them into the ocean. And again, just baby steps, and start to float them either on pool noodles on their back, and just to feel that water. And once you get your ears kind of below the water as you're lying on your back, being able to hear that heartbeat while you're breathing is just an incredible process. And I've had a lot of different kind of higher power moments with people who are in that place, as far as really helping to unlock and gently kind of, it's almost an exposure therapy at that point, because you're reliving that point, but a very, very, very subtle, soothing manner of getting to it. And it's just, being able to, again, just feel that heartbeat. So you're leading with your breath, and you're hearing your body follow behind, and you're hearing you're allowing your brain to follow behind that. You're just feeling all the sensations at the same time.
And Paul, or sorry, Tyler, do you want to, Paul, you were saying that you were doing the small breath holds, but then you kind of got the hang of it. Was it, in what way, or how do you feel that you got the hang of it? Did you have a different understanding of what was going on?
I just kept at it. Patrick, I was reading into it, I know, do you know what I mean? I've been obviously reading the manual on that, and I just started to understand I think it was caused by the trauma, do you know what I mean? And I just pushed myself through it, do you know what I mean? At first.
So you kept doing the small breath holds?
I kept it. It was a walk. I started doing the walking breath holds, you know what I mean? I stopped doing the small one, and I kept doing it. It was just, when I was walking, just focusing on getting more steps, you know what I mean? And you take yourself out and you focus on actually doing the steps, you know what I mean? It takes you out of your mind, you know what I mean?
It does. Yeah.
It's like a meditation, you know what I mean? It is like a meditation, you know what I mean? Just try to relax my body and just focus on getting counting more steps, you know what I mean?
Yeah.
It definitely works.
I've had, like, I remember, I'm in Galway here in my own studio, and I remember going back, I don't know, it could be 10 years ago. I had a 20-year-old come in, and he was a big guy. He was coming in with asthma, and I was having him do the breathe light exercise, and I had him do breathe less air to the point of air hunger. And I had him do it for 4 minutes. Now here's a strong 20-year-old. He started crying. And I said to Anna, I said, will you bring him, because we were in a small group and I wanted to kind of get him out of the group just for himself. And I said, bring him outside and do the walking with the breath holds, the exercise that Paul was talking about there. And that exercise worked for him. And all I did was I got him to do breathe in through his nose and out through the nose, and pinch the nose and hold the nose and walk for about 10 paces. And you know what, even if you start off at 5 paces, because sometimes you
I started with 5, it was 5 I started with, you know what I mean? It was, cause I just find it dead hard to do you know what I mean? Even though I was doing this deep breathing, it was, I think, I don't know if it was because I was holding my nose and I felt sort of suffocated more, do you know what I mean?
But this is the key, Paul, and this is the teaspoon that Tyler was referring to earlier on. You started off, you took a normal breath in through your nose and out through your nose. You pinch your nose, you hold your nose for 5 paces. Then you let go. And you breathe normal. So you know the end is in sight. You know that it's a short duration and it's a small enough. well, I'm not going to say a small dose of air hunger, but for the person, it could be a strong enough dose for that person. So you do a few 5s, and then you might build it up to,
10.
did you build it up to
10,
7?
I've done it. No, it was 10, I done it, 10, aye.
So you went from 5 to 10, then to
25, I'm at the, you know what I mean?
You didn't waste time.
No, it works, you know what I mean? What can you do? It's just, I can feel it getting me fitter, do you know what I mean? I can feel my lungs opening up. It's just, you can actually feel it, do you know what I mean? You feel my breathing getting lighter and a lot more. I smoked for years and all, do you know what I mean? I smoked cigarettes for I was 10-year-old and all, do you know what I mean? On and off for about 10 years there, and try to stop, and I think that's worse for you. Try to stop and then starting again, do you know what I mean? I think I could feel a lot of crackling, a lot of pain in my chest, do you know what I mean? A lot of bad circulation and that, and all, do you know what I mean? And I stopped doing it all, and I could feel it just help me. It's all helping me, you know what I mean? Everything I'm doing.
And the breath holds do stop you thinking when you do a breath hold like that. And I think there's a couple of things going on, but I think one is the carbon dioxide building up in the blood. So you're increasing blood flow to the brain. Like I know most people will say that get rid of the carbon dioxide and bring in as much oxygen as you can, but if you do a breath hold like that, CO2, carbon dioxide, increases in the blood a little bit, and this helps to increase blood flow and oxygen delivery to the brain. But you're also stimulating the vagus nerve, because you can stimulate the vagus nerve by taking a very soft breath in and a really slow and relaxed, gentle breath out. But for some people, that slow and relaxed, gentle breath out might be just a bit too challenging for them. And instead, you could breathe in through your nose, breathe out through your nose, pinch your nose, and hold your breath for 5 to 10 paces. That's also likely to stimulate the vagus nerve because you're extending the exhalation. And carbon dioxide seems to have some effect in stimulating the vagus nerve. So in terms of the physiology, all we're doing is tapping into the physiology to help dampen the stress response and increase the body's rest and digest response.
And I think that I was reading a report on it and all the vagus nerve and how that deals with trauma. That's where all your trauma gets stored. Do you know what I mean? I never even knew that. I never even heard of the vagus nerve till about six months ago. Do you know what I mean? And that's where, obviously that helps it and all with your breathing. If you're opening that up, obviously it deals with the trauma and all. Do you know what I mean? It's crazy, man.
It seems to be that people with trauma and people with anxiety and panic disorder, depression, irritable bowel syndrome, they have low vagal tone. So their vagus nerve isn't as sensitive or as reactive as it should be. And what we can do with the breathing exercises is we strengthen what's called the baroreflex, which are pressure receptors, but that in turn then is influencing vagal tone. So the vagus nerve then is just working that little bit better. And when it's working better, then we can change our physiology, you know? Like and
that's, sorry, Patrick, but that's, that's the beginning stage, is just changing that physiology through understanding how it works under the hood. And I mean, you do such a wonderful job of explaining that science and how the chemistry works. And that's the first step as far as explaining it that way, rather than mentioning the mindfulness and the meditation. You give them this and the facts of how it works. And when you start with that, and I mean, you gave the numbers of, I think it says 60 to 65% of the general public suffer some sort of anxiety or panic disorder. I wonder if those numbers have gotten higher since amidst the pandemic we're in. But and I know for a fact, and through research that we've started to do, it's a hell of a lot higher than that with people new to recovery. So that anxiety is a lot higher, the early stages of recovery. But that's where it starts, is at 65%, and then as it goes forward, what and how it's helpful all the way along is it's the men and women that go through the program, whether they're professional athletes or tactical athletes, military, first responders. It's when they leave treatment or finish the breath control training program and they get back to their teams or their units or their departments. And then they start talking to their guys, and I get the phone calls like, our guys need this, and our guys really need this, and we need to get this going to help everyone at this stage. So by no means is this something for just the recovery process. This is for every single stage of the process, and that's why I set up partnerships actually with the Canadian Armed Forces and with professional sports teams and with national Olympic sports teams to partner with these teams and with these divisions and instill it as part of the regular training, the regular exercises. Because, I mean, it's not about recovery, it's about the whole process. It's about the performance side of things once you get through that recovery and get back up and running. You know, so it's just about, that's how we can deliver it and make sure that we're helping people at every stage with that resilience factor. I mean, a lot of people, I mean, are already resilient. So we're not teaching them how to be resilient.
Well, we may be.
Pardon me?
No, I think we're optimizing it really. Even with elite athletes, they can have taxed their nervous system too much. They can be in hyperactive parasympathetic response. They have high HRV, so it's not necessarily about increasing HRV, but it's more about optimizing it. But there's one point that you did make. Brett has had a bad rap for so many years. And for many people, they were putting out a lot of nonsense. Okay, people will say I'm being judgmental saying that. Well, I said it. There's more to the Brett than what has been out there for years, and we really have to the depth to where we can go with this. And when we're talking about in terms of improving sleep, focus, concentration, attention span, resilience, stress handling abilities, and yes, the military have been taking this on, and which is great. But then again, the military are innovators. You know, it's going to happen in the military, and then it's going to happen more in sports. Starting to happen a bit in sports now as well.
And it's a mental wellness package, right? Like as the full physical performance and mental performance package, and that's why it works so well.
Well, it does. Right, especially with alpha males, because they'd run a mile if you're going to tell them that you're going to do breathing with them. But instead, when we put the focus that this is a high performance tool, so this is about getting the edge, and you know, of course, mental performance is in that. Those athletes,
in those elite high performance athletes, in some groups, it's upwards to 50% of these high performance athletes that still experience exercise-induced asthma. So dysfunctional breathing is caused. And through that, right, there comes the anxiety after, and there comes the loss of focus, the loss of concentration. They lose the ability to, you know, capitalize, to have that judgment, to have that call. So it's really starts at any point to put this into progress for an optimizing, like you said, that's the best word to describe it at any level for a professional athlete or anyone off the street.
We're going to bring to a close, and what I would like, so if people want to make contact with you, Tyler, it's through Breath Control.
That's right. breathcontrol.ca is the best way to find me.
Paul, I would really love to see people who are trying to battle with recovery getting in touch with you, and for you to go through breathing exercises with them. To guide. I think there's something about somebody who's gone through the journey.
So I'm just starting up now, Patrick. I'm trying again. I've still got my test and that to do, and then I'm going to. I've got a plan. You know what I mean? I've got a plan wrote out. You know what I mean? So I'll be up and running.
Well, we need to put that plan into action.
I'm just going to. You know what I mean? Hopefully I can help people with it. Do you know what I mean? Because I really think it can. It's camped my whole being down. I could have never sat here and spoke to MD about 7 months ago. Do you know what I mean? I really couldn't. Mindfulness helps and all. Do you know what I mean? I looked at you. I got your mindfulness techniques and that and all on the page and that and all. And they work. Do you know what I mean? It's Eckhart Tolle stuff and that and all. I've read that.
Big fan of Eckhart Tolle.
I do. Joe Dispenza and that myself. Do you know what I mean? It's all good. It's all good stuff. Do you know what I mean?
I have a feeling, Paul, that what you've already shared today and your story and how you're going about it and you're marching forward through it is already going to be.
Thanks very much, Taylor.
A lot of people.
Honestly, it's been a pleasure, man.
Yeah. Because it will be very comfortable. You're coming from a very genuine place, and your story is remarkable. I know there's people, you know, that have faced similar situations. Unfortunately,
there's people out there that have done worse things. Do you know what I mean?
It's not unique.
Been through worse stuff. Do you know what I mean? I'm not. You know, do you know what I mean? It's a big world out there, and there's a lot of bad stuff in it. Do you know what I mean? But there's this helps, you know what I mean? It helps you get over.
If I was a recovering addict, I would like to have been reaching out to you, because especially with somebody who was able to identify with the process and with the journey and with the hardship and everything else. So Paul, you will have your details listed on our own website anyway in the coming weeks in oxygenadvantage.com, and that's one way for people to reach out to you. And yeah, we'll keep this discussion going, because I think it's really important. You know, let's get breathing out there and putting it into practice for improved sleep and recovery for people with trauma and for people who are also recovering from addiction. And I think it was a great conversation. Well done, guys. Tyler, thanks very much. It was super. And
thanks, Patrick. Nice to meet you, Paul.
Cheers. I think my wife will have, son. I just noticed my ladders are still out in the back behind me there. She watches it.
She'll watch it, don't worry. So, yeah. So I'm going to close off at that.